Hello, welcome to our Kirka poster. We are part of the undergraduate nursing program at Westfield State University. My group includes myself, Angela, Kaylin Carpenter, Grace King, and Hannah Tripp. Our project is exploring the impact of palliative care with oncology patients. Palliative care is supportive, specialized medical care with the aim of improving well-being and lessening suffering in individuals with serious illnesses. Palliative care is underutilized, despite cancer patients facing many physical, emotional, and psychosocial symptoms. Globally, only 14% of patients who need palliative care currently receive it. Previous research studies that integrated palliative care into standard oncology care showed an improvement in quality of life, specifically in elderly cancer patients. Based on the evidence, this project plans to evaluate the impact of palliative care on elderly cancer patients' quality of life when used in addition to standard oncology care. Our project proposes a qualitative study with oncology patients over the age of 65 who are attending 2 oncology centers and receiving palliative care. This study will occur over a 3-month period. The participants will complete pre- and post-surveys about the impact of palliative care on their quality of life. Potential outcomes will be presented regarding the type of care for patients with cancer and its impact on quality of life and patient satisfaction. The incorporation of the evidence supporting palliative care will provide information that will be impactful to the future of oncological care in elderly patients. If further support is beneficial, providing patients with palliative care along with the standard oncological care will improve patients' physical, emotional, and psychological well-being and become the standard of care.
The overall research question that we created to start was, how do elderly patients with cancer receiving palliative care with oncology care compare to standard oncology care in terms of quality of life? The study itself would be a qualitative research study with oncology patients over age 65 who are currently attending 2 different oncology facilities, but are also starting to receive palliative care in addition to standard oncology care. Participants will be randomly selected within the parameters. The patients will take a pre-survey before implementing the palliative care and 3 months after the combination therapy. The survey will ask questions about patient satisfaction, emotional, social, and physical well-being. The survey will use qualitative measurements to assess if there was an improvement in the overall quality of life when combining the 2 types of care, palliative and oncology care.
To implement palliative care, multiple things need to be done. The diagram on the poster clearly outlines the 5 main concepts important to integrating palliative care with standard oncology care. The first is education, where all oncologists should be palliative care competent. Another intervention for education would be testing for palliative care skills in exams. The clinical structure part of the integration could include implementations like outpatient clinics, palliative care units, and community-based teams. Under the research category, one would have to research publications on palliative support and find funding to support this integration. The clinical processes implemented could use simultaneous care, clinical care pathways, routine symptomatic screening, and many others. In administration, national standards or policies need to be considered. In addition to this, public awareness and advocacy is important when integrating to something new.
Under synthesis of evidence, there are a few bullets that are research studies that our group found to support integration of palliative care. The first study showed that palliative care consults proved to decrease aggressiveness of cancer treatment and increase quality of life among cancer patients. This study was conducted at St. John's University. The second study showed improvement in health-related quality of life following specialized palliative care, especially for symptoms like pain, nausea, fatigue, which are common with oncology patients. This research was conducted using 5 randomized controlled trials. The third research article that our group found proved that palliative radiation showed improvement in quality of life, decreased depression rates, and bettered the survival of these patients. This was an observational study done at 2 tertiary centers. In conclusion, palliative care is aimed at reducing symptoms and providing comfort, but there's a common misconception that palliative care means death or giving up. It can be used in combination with standard oncology care, which can be very beneficial and show improvement in quality of life. It should be implemented among all oncology care facilities because it can improve any oncology patient's well-being and overall quality of life.